Okay, now that Medicare annual enrollment is upon us, it all starts right away tomorrow morning. We've got a lot of things that are going on here, and I want to talk about here in this short video why ignoring Medicare annual enrollment could be a massively huge mistake and a very costly mistake for a lot of people. There's way more to it than a lot of people actually realize, and I want to talk through a bunch of those details for you. And again, as my dedication to you in this community is to not only help you maximize your benefit, but also answer your questions, to be here for you, to advocate on your behalf in any way that I possibly can, and point out different ways that you can save money and also protect your money, your finances, and everything else. So we're going to talk about a lot of different things here in this video. Now, if you're one of the 70 million people on Medicare, please take a few minutes, listen to this video. This is not going to be a very long live stream, but I do want to share with you some of the key details you probably want to think about, you want to pay attention to, and what you want to look at as Medicare annual enrollment opens up right away tomorrow morning, literally less than 24 hours from right now. It all starts, and it's going to be nuts for about 7-ish weeks that this whole thing is opened up. All right, so anyway, let's talk about some of the details around this. So number one, when a lot of people look at their Medicare plan for the upcoming year, they look at one thing. Now, obviously, not everybody, I'm saying in general terms, a lot of people simply look at one different metric, which is the premium. How much is my premium? What do I need to pay per month? This is kind of the big problem with this, because we often get distracted by the premium. We look at the premium and we're like, oh, it went up $20. Let's, change our plan or whatever. Or, my premium is staying the same. I don't need to do anything. That's a massive, massive mistake. Think of it this way. It's like dissecting something, right? You got to get into it and look around inside to make sure that, everything within the internals are actually looking very good, right? So it's like popping the hood on a car, right? You kind of need to know what's inside to figure out, hey, is this thing working properly or not? Is this the best fit for me and my personal situation? Same situation when it comes down to your Medicare plan. So I'm going to point out a bunch of different things here that I just want you to think about when it comes down to your situation, and you probably want to pay attention to this when it comes to your plan as well. So number one, yes, the premium is a very important thing, but it's not the most important. By far, it is definitely not the most important. And honestly, it almost seems like this is one of those different metrics around Medicare plans that's put out there to distract the beneficiary so that we don't see the other aspects of the plan, okay? Please do not get distracted by the premium. Premium is important. It's definitely something we want to look at, but does not tell us the whole story. A couple of the things that I want you to think about are this. Well, there's more than a couple. There's a whole long list here. Number one, a very important aspect is this. Are your doctors still within network? We all have certain doctors, different doctor groups, different hospital systems we want to have access to, different clinics, different offices, all these different aspects like this. Are these that you regularly go to still within network? A lot of people don't realize this. Networks change every single year, okay? Obviously, different plans keep the networks, but for the most part, offices and clinics go in and out of network. Doctors go in and out of networks all the time. Hospital systems, sometimes they're within network, sometimes they're not, right? Got to look at all these different details and make sure and still, qualify that your doctor that you want to see, maybe it's a 1 or 2 or 3 doctors that you see regularly, or even just the doctor group, right? Are they still within your network? Okay, very important one there. For those of you that are on Part D plans, as in Part D, for your prescription plans, okay? This is not everybody, but for those of you that have a Part D plan, are your prescriptions still covered, right? Have they changed the tier in which they're located in, right? Are they formulary or are they off formulary? It's a very big key one there as well. If they are off formulary and they were formulary for this year, that may mean that you may need to sit there and argue with them every single month when you need to go and get a refill and they say, sorry, not covered anymore, or it's not formulary, therefore you got to sit there and argue with them to get them to pay for it. It's a very big one as well. Not only that, what about the pharmacy that you regularly visit? The one that you visit, is that covered, right? Do they still, are they still a pharmacy that is supported by your insurance plan? A very big one there as well, okay? Now, a couple of things I want you to look at as well. When you look into your plan, not necessarily Part D, but just your regular plan, what about your copays, right? Those probably are changing. That's another really big one as well. Not only copays, but What are the copays as they're broken down, right? I think most of us recognize this. Copays are generally different between your primary doctors, right? Like the family practice doctors or somebody like that. And then the specialists. When you go to see a specialist, generally those have a different copay as well. What are those going to be? Are they staying the same? Are they going up? What is happening with them? Not only that, deductibles. That's another really big one. Deductibles. What is your deductible? This generally changes as well. Okay. Got to look at that big picture because remember, at the beginning of this live stream, I said, you have to look at your premium. But let's just say the premium goes up by, say, $5 or it stays the same. That might be a little bit of a distraction to think, look, the premium is staying the exact same. Meanwhile, they're raising the copay by $5 or $10 or more, right? Maybe they're raising the deductible by $1,000, something like that. That's going to offset the premium staying the same dramatically, right? That's going to be a lot more money out of your pocket if we just look at the premium, which is why I said it's a good metric to look at, but certainly not the best metric to look at because all of these different aspects are changing. Here's another really big one as well. What is your max out of pocket? This changes all the time as well, okay? What is your max out of pocket? Take that into consideration. If things get really nasty and you need a lot of medical attention and procedures and whatever else in the upcoming year, what is the max you know that you would maybe have to pay out of pocket in the event of something where things, start to get really bad and expenses pile up significantly? What is the absolute most worst case scenario you would have to pay out of your pocket? That's another big one as well, right? What is the max coverages for Medicare covered procedures and whatever Medicare covers, right? So again, what is your max there as far as how much would you have to pay out of pocket for whatever Medicare would also be paying? It's a very big one as well, okay? So there's a lot of moving parts, as you can probably tell here. And here's the thing that I want to point out. Most of these change every single year. A lot of these different metrics change all the time. For example, copays change a lot of the time, not always. Premiums change almost every single year. Doctors go in and out of network, as I already mentioned. That's one thing that changes quite often, not all the time. But here's something that changes virtually every single year, which is deductibles change pretty much every single year. Max out of pockets change pretty much every single year, right? Got to know all these details around this. Very important for the overall cumulative picture to get a better broad look at where's your plan, is it still the best plan for you, and where are we currently at for the upcoming year, and how does it compare to your current plan right here, right now that you may have, right? So a lot of different details around this, okay? Now, a couple other things as well. If I break it down to just Medicare Advantage, now everything I was just talking about right there is just across the board, all Medicare plans, everything like that. But if I just focus on Medicare Advantage for a minute, think of this. You've been hearing me talk about this a lot lately in videos, which is hundreds and hundreds and hundreds of Medicare Advantage plans are literally being discontinued, eliminated, going away for the upcoming year. So millions and millions of people that are literally losing their plan. The plan just goes away. It doesn't exist anymore. So it's not even an option anymore. The same thing goes with Part D plans going away, discontinued, eliminated, whatever you want to call it, gone for the upcoming year. That's a really, really big deal for the millions and millions of people on these plans where they're there and all of a sudden now they're not, right? It's a big, big deal. So we have to look at all of these details just to make sure that we are still properly covered for the upcoming year. Again, I want to point this out as well. Your plan probably changed. I mean, most of the plans changed, but not only that, think of this. All of the other thousands and thousands and thousands of plan options that are out there. By the way, there's over 20,000 plans across the entire country. So there's a lot of options, as you can tell, right? But anyway, 20,000 plans across the country, right? So your plan changes, but guess what? All of the other plans are also changing. What that means is that there's a high likelihood, obviously no guarantees, but there's a high likelihood that there's another plan out there that is also a better fit for you for the upcoming year. You see that, right? So maybe your current plan is still the best plan for what you need personally for the upcoming year. It may be, but here's the situation. Think of it this way. Have you ever heard the saying, I mean, you hear this from people all the time, you should shop your car insurance every year. Why? Same reason we're talking about here. I mean, I'm not sure about you. What's more important, your healthcare coverage or your car insurance? I'm just gonna be fair with you. smash the car all you want. I don't really care. You know what I mean? I don't care about the car. I care about my health. I care about my health a lot, right? Same situation here. Do you care more about your car insurance or your healthcare insurance? But yet we hear people say all the time, shop your auto insurance all the time. You'll get a lower premium. You'll get better coverages. You'll get, less out of pocket, max out of pocket, things like this. Again, you hear this all the time. You hear the same thing that people come in and say, you should shop your cell phone provider every 2 years or whatever, your satellite or your cable provider, your internet provider. You should be shopping these services every year. Why? Same thing here. Again, who cares about insurance? About internet coverage? Who cares about cell phone carrier? Who cares about all this stuff, right? Again, at the end of the day, what is the most important one out of all of these? As I mentioned, it's healthcare coverage, at least in my opinion it is, right? Our health is ultimately the absolute most important. But yet we hear all these other people suggesting we should shop all these other things every year because we might save 14 cents per month on a different plan. Yeah, that'd be awesome. But you know what? You could probably be getting that savings alone just out of your healthcare plan, plus a whole lot more, just by literally looking through it and making sure that you have the best plan and the best coverages for the upcoming year. This is so incredibly important, right? And again, I've been pounding the table on this for quite a few weeks now because so many of these plans are changing. This is going to massively disrupt the livelihoods of so many people that are currently on Medicare. It's nasty to see this. Have you seen all this, right? Not only that, I talked about recently the prior authorizations. Have you heard about this, right? So they're offering this pilot program. I shouldn't say offering. That's the wrong word to say. They're implementing prior authorizations in 6 states. They're calling it WISER, W-I-S-E-R. That's what it stands for. That's like the acronym for this. But it's a pilot program across 6 states where they're literally implementing AI to do prior authorizations for 17 different conditions. Do you think the people that have these 17 conditions are going to get that prior authorization? In other words, permission to get treatment for? Good luck. Yeah, good luck. I hope none of you here in this community have these 17 conditions, because that's going to get nasty if you're located within one of these within one of these 6 states that is implementing these prior authorizations. It's going to be bad. And it's going to be AI doing all of it, right? That's going to get bad for a lot of people. So kind of outside the scope of this video as far as what I really want to dig into, but you get my point, why this is so incredibly important. And again, I've mentioned this before in other videos. This is possibly the most important and pivotal time of year, or this year alone going into next year, because so many things are changing when it comes down to all these plans. Now, obviously, when it comes down to Medicare Advantage and Part D plans, we do see adjustments with these every single year, but not nearly to the extent that we're seeing for this upcoming year. They're eliminating so many plans. Some carriers are completely eliminating access within different states. They're eliminating different counties across the country. There's a lot of people that are going to be completely blindsided by this. And again, when a lot of these individuals got their annual notice of change letter in September, it should have outlined a lot of these details. The problem with that is a lot of times these annual notice of change letters are pretty long and they have a lot of details within there. Kind of seems almost intentional, kind of confuse the individual when it comes down to these details. Kind of makes sense? Okay. So anyway, I'm going to point something out. You probably already noticed this. I'm just going to say this super fast. As we roll into Medicare Annual Enrollment, okay, starts tomorrow morning, bright and early tomorrow morning, Medicare Annual Enrollment opens up. That means 70 million seniors on Medicare can do whatever they want, essentially, okay? I shouldn't say whatever you want. There's always some restrictions, right? But for the most part, virtually everybody on Medicare can do pretty much anything they need to with their Medicare plan. It is by far the most versatile time of year for Medicare beneficiaries, for everybody on Medicare, 70 million people. Anyway, leading up to this, I partner with Chapter Medicare. Phone number's right here. It's 100% for free for those of you in this community. Phone number there. Here's the deal. They've recently implemented 7 unique and very strategic different ways that they can better serve you faster, easier, and completely for free right now for annual enrollment, okay? They're going to serve you way faster and better. Again, totally, completely, 100% for free, okay? So there you go. Phone numbers for you right there. Again, give them a call. If you call them today, their phone's not ringing off the hook yet today. I mean, they're probably getting some calls. I'm just saying that much. But Their phone is not ringing off the hook today. Tomorrow, their phone will be ringing off the hook. Again, they've got these 7 substantial upgrades and advantages over other people as far as how they can serve you significantly better, significantly faster, and again, totally free. And they're going to take care of you. Seriously, they've already helped thousands and thousands of you here in this community, which is absolutely amazing to see. So many people are saving a boatload of money. I've been sharing with you in other videos how much people are saving. The average savings, by the way, is $1,100. There's people out there saving way more than that. I can tell you that much. There's people I could name right here, right now. Ken J, Ed F. I was going to say his last name, Ed F. I mean, I could go on and on right now. Beth C. I have a whole list of people that have saved thousands of dollars, like well over $2,000, just literally by calling them, having a quick conversation, and just finding the best plan for them and their personal situation. So there's a lot of things that we could be doing right now. But again, if you want to get on their books, here's what I would suggest with a quick little pro tip. Give them a call today. Again, phone number's there. Give them a call today before their phone starts ringing off the hook tomorrow, and just be like, hey, I just want to get on your books. Just kind of set an appointment to talk to you. They're probably going to gather some general information. That's okay. It'll speed the process up. It'll expedite the process once you have your time with them to actually talk and go through a plan, everything like that. But seriously, it's incredibly important this year, okay? Anyway, I was reading a statistic yesterday. Apparently last year, 7 out of 10 people on Medicare did not even review their plan. 7 out of 10. That's a sad statistic. And the reason that I say that is because there's a lot of people, if that's the same statistic going into next year, I'm going to say this much. Unfortunately, there's going to be a lot of people that are going to be on the wrong plan. And unfortunately, they're probably going to get financially hurt in the upcoming year because they're on the wrong plan. And all of a sudden, we got a huge medical bill. Why? Oh, it's not covered. That doctor isn't covered anymore. That hospital system, that doctor's office isn't covered anymore. We're now out of network. Whoops. Now we got a big bill. Oh, whoops. My prescription my prescription isn't covered anymore. Dang. Now I got a big bill coming in, right? All these different reasons like this. That's way too high of a percentage or a statistic, I should say, is 7 out of 10 people not getting their plan reviewed. That's bad. Anyway, right here, my partners over at Chapter, again, within 10, 15, maybe 20 minutes, Again, depending on everybody's situation, it's going to be a little bit different for everybody. Within literally a matter of minutes, they'll be able to go through their database, 20,000 plus plans that they have access to right at their fingertips, that they can look through and they can find you the best plan at the best price with the best coverages for you and your personal needs for the upcoming year, literally in a matter of minutes. That's incredible, right? So again, if you're already on the best plan for your personal situation, they will very loudly and clearly tell you that, hey, you've got the best plan. Don't do a thing. In fact, they've done that. I've seen comments right here on the channel from a number of people here in this community that have reached out and said, I talked to them, they helped me, and they told me I was on the best plan for my situation. That's amazing. I also have hundreds and hundreds and hundreds and hundreds of people that have literally reached out in comments and said, I called, I was on a bad plan. I'm saving $174 a month, $170 a month, $159 a month, $161 a month, $310 a month, $94 a month, $151 a month, $79 a month. Again, the list goes on and on. I could sit here and rattle off all kinds of names and dollar amounts that people are saving literally just by calling them and getting their plan reviewed to make sure that they're properly covered. Anyway, if you want to give them a call today, all I'm saying is that you can't change your plan yet, but if you call them today, at least you'll get on the books. You can get your plan identified. And then once the annual enrollment opens up tomorrow or whenever you schedule an appointment with them, again, to talk, totally free, by the way, you can see it there, totally free. When you talk to them, there you go. It's just a matter of bang, bang, click a couple buttons, and there you go. Got yourself locked in, which is way better. And again, it's going to be nuts this year. It's going to be absolutely nuts. And the current shutdown that we're going through right here, right now, is certainly not helping the current situation as far as all of this, right? It's just adding to the confusion. It's adding to the uncertainty. It's adding to the frustration. So if you're confused, if you're frustrated, if you're stressed out about Medicare annual enrollment, I can reassure you of this. Join the other thousands of people here in this community that have called them there. Again, it's free, okay? Totally free, totally free. Anyway, join the other thousands of people here in this community, contact them, have a quick conversation within a few minutes, literally a handful of minutes. You'll have an answer, and then you can just breathe easy. You're done at that point, right? So anyway, it'll be very, very good. So anyway, by the way, after you talk to them, drop a comment down below. Use the word chapter within your comment. Let me know how it goes. Just, I saved a bunch of money, whatever it happens to be. Let me know what happened with the phone call. How did it go? Did you get a better plan? Did you get better coverages? Did you save a boatload of money? What happened? Let me know. And I'd love to give you a shout out and feature you in an upcoming video. So I've already seen hundreds of comments. I mean, seriously, I've given so many shout outs to people lately over the last couple months here. I've featured tons of people. I've featured their comments in community posts. It's a lot of people out there, and I'm getting comments literally daily from people here in this community that have reached out saying, I called them and I got this help, whatever. It's really, really nice to see that. So anyway, just trying to help you out in any way that I possibly can through this. And again, I'm helping my parents go through this as well. And they're also planning for, doing all this research as well. I mean, they've already got their date set to talk to Chapter. I told you this yesterday in the live stream. Chapter called my dad on Sunday evening, literally like 6 o'clock on Sunday evening. My dad calls me, hey, just got off the phone with Chapter. They called me and I'm on the books for Thursday. So my dad is literally calling them, or talking to them, I should say, on Thursday. He's got a time booked with them on Thursday of this week. So a couple days from now to talk to them, to go through all that together as well. So it's good, right? Very, very important. And yep, just want to help you out with this. Okay. So as always, drop your comments down below. Comments, questions, feedback, concerns, whatever you got, drop it down below. Let me know, what can I do for you to help you through this? I want to help you. Okay. It's my dedication. It's my commitment, whatever I possibly can. Keep those comments rolling in. Here's another thing as well. You know what I've noticed about you lately? A lot of you here in this community leave very good, detailed, highly specific questions, which I really, really appreciate. I've been reading the comments and I like it. Like, people don't just reach out with vague questions. I mean, there's a couple of those every so often, but for the most part, like you right here in this community, ask very good, highly detailed, very specified questions, which I really, really like. So keep those rolling in. Tell me exactly